Hi, I'm Dr. Agatha Biss. The chorda tympani nerve, a vital branch of the facial nerve, plays key roles in taste sensation and salivation. Because it passes through the middle ear, this nerve is vulnerable to damage or pressure from conditions affecting the region, including TMJ disorders. One of the main functions of the chorda tympani is transmitting taste from the anterior two-thirds of the tongue. If this nerve is damaged or under pressure, patients may experience a loss of taste or an altered taste perception that can create unusual flavors like metallic or bitter taste, even without food. The chorda tympani also stimulates the submandibular and sublingual salivary glands. Damage or compression can lead to decreased saliva production, known as xerostomia or dry mouth. This can increase vulnerability to oral infections, make swallowing difficult, and elevate the risk of dental problems due to reduced saliva flow. Since the nerve runs through the middle ear, pressure or damage can sometimes result in ear pain or a sensation of fullness or sensitivity to sound. A common cause of damage or pressure on the chorda tympani nerve includes TMJ disorders, where the jaw's condyle is positioned posteriorly due to malocclusion or missing teeth. Treatment for chorda tympani nerve issues involves addressing the underlying causes, such as using a customized TMJ orthotic dental appliance to hold the mandible in optimal position so the nerve can heal, or surgical repair in more severe cases. If nerve damage is irreversible, some symptoms, like changes in taste and reduced salivary function, may persist. Understanding the chorda tympani nerve's vital functions and vulnerabilities helps in early diagnosis and effective treatment, ensuring better outcomes for TMD patients who are experiencing taste disturbances, dry mouth, or ear-related discomfort.